There's good news coming out of the opioid settlements. It's complicated because there are lawsuits all over the place, most of them not settled. One that was settled last week was Johnson & Johnson and New York State. Johnson & Johnson has agreed to spend or pay $230 million to the state of New York. There are suits now in Long Island against both the distributors and the pharmacies. There's a considerable amount of money there. And all in all, this influx of money, along with money from the Biden administration, is providing a real windfall for drug treatment and prevention. The concern that we at the Rosenthal Center have is this money going to be spent wisely? Do we have the leadership? Do we have the perspective? What has to be done is that treatment has to be expanded. And in addition to treatment as a subset, but really a big subset, is treatment in prisons, because we have a vast population in our prisons that have addiction problems, are not getting treated in prison, and certainly there is insufficient linkage to any treatment on the outside. And finally, we need to fund the development of workforce. We need to train people who are able to work in the community, who are able to work in prisons, who are able to work in residential treatment settings. The best people to train for this are people in recovery. They're passionate, they're authentic, they care, they communicate all this, and are able to engage patients. They must be funded.